we have Dr. Sukrit Bose from Apollo Gleneagles Hospitals, Kolkata, and we would be discussing voice change. We all know voice is an integral part of a person's identity, and the doctor here would help us understand how it affects us mentally as well as physically. So,
Good afternoon. Welcome you all. See, voice, as he rightly mentioned, it's a person's identity. It's the way one expresses himself or herself, and it's very important component of one's mental and probably physical well-being as well. And it is important to have one's own voice in an absolute normal way, and every individual has got a different voice. Like every individual is different in the way one looks, in the way one behaves, so the voice is also unique, and it is somewhat gives an identity to the person. So it's something which is very which has to be taken care of, and we will, in the course of a few minutes from now on, we'll discuss about a lot of ways the voice get affected and how we can take care of it, and what are the common voice affections and how we treat them.
so we would be having a few questions, and we would really appreciate if you could answer them for our audience. First question that we have is if you could discuss what are the major causes of voice change.
See, voice is produced by something called as the organ is called as larynx, and it has got vocal cords, vocal folds, and vocal cords are responsible for production of voice. Now, this voice resonates in the oral cavity, or the oropharynx, as we say, and ultimately we hear a sound. But the main production of the voice is it's generated in the vocal cords, and the vocal cords are vibrating, and the vibration of the vocal cords produces voice. Abnormality in any of these structures would give or produce a change in voice. If there's a disturbance in the movement of the vocal cords, if there's any morphological changes or anatomical changes in the vocal cord, like say if there's a swelling in the vocal cord, or if the vocal cords are not moving properly, or if there's a tumor in the vocal cord, these are the commonest conditions probably where you would have a change in voice.
When should one consult a doctor for voice change?
Voice change is something which is a very early symptom of a disease. I mean, it is probably an earliest indication that there is something wrong in the vocal cords, and it can be as simple as a common cold. Even if you have a bout of common cold, you can have a change in voice because of the swelling of the vocal cords, and it can be as lethal as cancer of the vocal cord. But because a change in voice is immediately noted not only by the patient but also by his relatives and friends, who immediately point out that there is a change in your voice, so it gives you a very, very early symptom, or a very, very early knowledge that there is something wrong in the vocal cord. So if the voice change persists for more than 2 weeks, definitely it's cause for a person to go and visit the doctor. But if there are times that sometimes you have a voice change even after a bout of screaming, or you might have a voice change after a common cold, and if it persists for more than 3 to 4 days, I think it's better to go and consult a specialist who would evaluate the condition of your vocal cords, and evaluate the condition of your vocal cords, and tell you what needs to be done and get treated.
So the next question that we have may not be very much related with voice change, but a concerned father after all says that 6-month-old daughter fell down and there's a swelling in the head. So what should ideally he do? Since we are connected with an audience.
Okay. No, yeah. Although this is not we're not discussing it, but of course, just to help him out, I think he needs to consult a pediatrician first. And if the child has fallen down and if there's a swelling, go to the pediatrician who looks after the child. The pediatrician would guide you. Probably would need a neurological evaluation if there's injury or if there's any hematoma or blood collection because of the fall. So without wasting much time, earliest should try and contact the pediatrician, and definitely he or she will help him out.
So getting back to voice change, we believe there are various types of voice changes. If you could elaborate on that.
Yeah, as I said, it can be acute. I mean, it can be a very short duration, sudden. There could be a sudden change in voice, and it could be precipitated by a shouting, screaming, or even, a bout of cold. And it can be chronic, like it's gradually been there or persisting for more than 7 days, 10 days. So that's a chronic voice change. Now you can have a breathy voice, as in where you don't hear. It's like a very breathy voice, like this, or it can be a husky voice, or it can be a hoarse voice, like that. It can be, the voice can be heavy, as we say. So these are the common ways the patient would describe to us. In all these conditions, it is very important for us to have a look at the vocal cords, which cannot be seen externally. So we use something called a laryngoscope or a laryngoscopy technique to visualize the vocal cord or the larynx and evaluate the movement of the vocal cords, and also evaluate if there's any structural damage or changes in the vocal cord, to see what exactly has happened, and then we treat it accordingly.
What are the early signs of cancer of vocal cord?
The first sign would be a hoarseness of voice, which is very commonly described. The patient would complain that there has been a voice change, and in Bengali they would say awajta ekটু ঘষা ঘষা লাগছে. So it's like a broken voice, and that probably would be persisting for more than 7 days, 10 days, or more than 2 weeks, if the voice would be persisting. And that's why vocal cord cancers have got a very, very good outcome, or treatment outcome, or prognosis, as we say, in terms of early detection, early, and treating them early. They have a treatment success rate of almost more than 98%, because the symptoms are detected so early. The voice change is a symptom which cannot go unnoticed to anyone. Although it's a painless thing, but it would definitely ring a bell that yes, there is something wrong in my voice, and the patient also feels, and as I said earlier, the patient hears his own voice, or his friends or family even who's talking to would tell him that there is a change in the voice. So he would go to the doctor, and if it's diagnosed in a very early stage, then the treatment outcome is very, very good. It's almost in the tune of 98 to 99%.
So today many people have profession related to voice. How do they take care of?
Yeah, we have voice clinics at a lot of hospitals, and the concept of voice clinic has really been formed, thinking of professional voice care. Now, as in every profession, like a sportsman would be succumbing or would be having sports injuries, which is a very big specialty now, treatment of sports and rehabilitation. Similarly, voice, taking care of voice and voice rehabilitation is also a very, very big unit, and we have voice clinics. Now, professional voice users, it can be, it's not only a professional singer, or a film actor, or a theater artist. Even a teacher is a professional voice user. Even a lawyer is a professional voice user. So whose profession depends on his voice, and he has to take care of his voice. And the patient, and if there is any abnormality in the voice, in his voice, he needs to consult a voice specialist. And we have voice therapists in our voice clinic, or speech therapists in our voice clinic, who would guide you how to take care of your professional voice.
So, if you can speak about laser in vocal cord surgery.
See, there are a lot of conditions in the vocal cord which give rise to change in voice. It could be a nodule, it could be a small swelling, it could be a polyp, which is again a small swelling attached to the vocal cord. It could be a vocal cord cancer, or a growth in the vocal cord. It could be a vocal cord edema, or if there's a collection and swelling in the layers of the vocal cord. If these have to be operated, a laser is a very useful tool to operate on the vocal cord, because it is precise. It has got very less side effects, and it's a very handy tool in terms of in terms of the precision that it gives in operating on the vocal cord. So it is a very recommended device. It is not that it is mandatory to operate everything with a laser, but of course it gives you definitely an added advantage in certain cases when we are operating on the vocal cord.
So someone in the audience has a question. Because of acid reflux in my voice, uh, it has become very hoarse and is termed as LPR, diagnosed as posterior laryngitis. So what is LPR and how can it be treated?
LPR is a form of laryngopharyngeal reflux. So what happens is if there is an acidic reflux and because the from the larynx actually the air passage and the digestive tract, they take two different routes and there's a junction from where it does, and the laryngopharyngeal reflux happens in that junction, which is the posterior attachment of the vocal cord. So it usually causes posterior laryngitis and a lot of congestion and edema around the posterior part of the vocal cord where it is attached. Now, because of this, more commonly the patient would feel a symptom of something stuck in the throat, or he would be frequently clearing his throat. He would feel a foreign body sensation in the throat, and voice change would be a very late manifestation of laryngopharyngeal reflux, I would think so, because by that time the patient would be so concerned about all this, the patient would visit a doctor. This is what laryngopharyngeal reflux. They usually treated by medicines, anti-reflux and proton pump inhibitor medicines are given. A few lifestyle modifications are advised, and of course the patient needs to drink a lot of water, avoid long hours of remaining empty stomach, and timely meals, short timely meals, and avoiding too much of oil, and of course having early dinner and not retiring to bed immediately after dinner. These are the few lifestyle modifications which need to be done in case of laryngopharyngeal reflux.
Another question from our audience. I have a very good voice, but my voice cracks often if I shout a little or speak in a little loud pitch. Any suggestions?
Don't shout and don't uh, take care of your voice. If you have a good voice, that's the only solution.
What are vocal nodules?
Vocal nodules usually are very small swelling on the vocal cords, and see what happens is voice is produced when the vocal cords vibrates and against each other. They vibrate and they come in contact with each other. So where there is a maximum point of contact, it usually there's a friction against each other, and if it is not taken care of as our previous question, he said that if I shout it breaks. So when you are shouting, you are abusing your voice. So when you shout or scream, the friction increases, and due to the constant friction, you develop small swellings on both sides of the vocal cords. So this develops into vocal nodules. It's very common in teachers, and it's also called as singers nodules or teachers nodules or even screamers nodules. So basically there is no medicinal remedy for this. The only remedy is just don't shout or don't scream, and take care of your voice. Do voice therapy, and drink lots of water, take steam. Those are the only things. If the nodules are very big in size, then of course it has to be removed. But removal is a solution of the nodules. But the nodules can even come back again if you are not taking care of your voice even after removing them.
Thank you, Doctor, for sharing your valued thoughts with our audience here. We are sure to receive more questions as well, and we'll get them across to you and try and get them answered for people here. Before we end this discussion session, what would be your suggestion to the young adults who have the opportunity to take care of their voice better?
I think the first thing is have an understanding of the voice. As I said, how it is produced, and it's a biological thing, so you need to protect it. And it's unique for a person. My voice is not going to be similar as yours, and his is not going to be similar as this thing, the intensity, the frequency, the pitch of the voice would be different. So take care of your voice, have a healthy lifestyle, drink lots of water, avoid shouting, screaming, and abusing your voice. And of course, tobacco is absolutely a no-no. That causes cancer, and it causes vocal cord cancer. So I think these are the things which you need to be careful about.
We have other questions dropping in. Would you like to answer them?
Yeah.
We have an educator who has to teach toddlers with one syllable. So, if you could suggest some exercises for improving the oral motor skills.
Yeah, I think this is a very challenging, because you have to really be on the top of your voice and take care, and maybe But what I would suggest is, firstly, don't stand at one position and teach. I mean, if you just move around in the room, so that you are heard equally well from the front and behind and all the sides. So instead of standing at one point and trying and reaching out to the toddler who's sitting in the back, instead of doing that, if you can keep on walking. There are a lot of collar mics which are available, which are not very expensive. You can use a small collar mic and a small speaker, which we usually recommend for a lot of teaching staff who do get vocal nodules or voice problems. And other thing is that as I said, drink lots of water. There are a few vocal exercises which if you can come to our voice clinic, we would be happy to demonstrate you, which is physically not feasible for me to demonstrate it over here. But we have voice therapists who would take care and let you know, and you follow. They would demonstrate a set of exercises which you can easily follow at your home and keep your voice protected.
Thank you, sir. I believe that's all we have time for today, and we are sure we will connect with our audience again in the near future.